I'm Chaka, and I'm going to tell you more about my research, protective influence of tocilizumab in COVID-19 patients with cardiac arrhythmias. So new onset arrhythmias are frequently identified in COVID-19 patients and are associated with significant morbidity and mortality. Although this is commonly related to comorbidities, electrolyte imbalance, and concomitant QTc prolonging drugs such as antivirals and antibiotics, cytokine storm, specifically interleukin-6, may play a role in development of potentially fatal arrhythmias in COVID-19. Tocilizumab is anti-interleukin-6 receptor monoclonal antibody, is used to manage autoimmune diseases by reducing systemic inflammation. It has also been approved for the management of COVID-19 patients. One of the practical benefits was the indirect antiarrhythmic effects and protective cardiac influence. However, this hypothesis was never tested in COVID-19 patients. I'll tell more about our methods. So this is a retrospective cohort study. We identified 200,000 patients across several facilities diagnosed with COVID-19 requiring high level of oxygen using invasive and non-invasive ventilation. We observed 84 sick patients without a previous diagnosis of cardiac arrhythmias and who developed new onset arrhythmias such as atrial fibrillation or flutter, supraventricular tachycardias, or ventricular arrhythmias. During hospitalization, patients were stratified into two groups based on the medication they received, a group who received only tocilizumab and a group who received a combination of remdesivir and dexamethasone. The aim was to explore if cardiac arrhythmias were less likely to occur in patients who received only tocilizumab versus a combination of remdesivir and dexamethasone. So our results showed next. The patient with COVID-19 requiring high levels of oxygen and who were managed with tocilizumab were less likely to develop cardiac arrhythmias than those on combination of remdesivir and dexamethasone. Patients who developed cardiac arrhythmias were more likely to be older, males, and Black. In our conclusion, patients exposed to tocilizumab were less likely to experience cardiac arrhythmias compared to a combination of remdesivir and dexamethasone. This highlights the possible protective cardiac role of tocilizumab in patients with COVID-19. And in terms of limitation, so the sample of the patients on tocilizumab was small. However, this still warrants future studies. Thank you very much.